Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Kevin Campbell. He's an orthopedic surgeon. Today's Kevin MD article is Healthcare is Having Its Yahoo Moment. Kevin, welcome to the show.
Yeah, thank you very much, Kevin. Thanks for having me.
All right, let's start by briefly sharing your story, then we'll jump right into your Kevin MD article.
Great. Well, yeah, I'm a practicing orthopedic hip and knee replacement surgeon working out of the Orthopedic and Sports Institute in Appleton, Wisconsin. And then I also work as the CEO and co-founder of Streamed, which is our AI healthcare technology company.
All right, and your Kevin MD article contrasts what's happening now with Yahoo, that legacy internet company. And for those of you who get a chance to read your article, tell us what it's about.
Yeah, the article is about medicine having its Yahoo moment, and it really contrasts the approach that Yahoo and Google took in terms of organizing the internet. Yahoo organized it with human review and their editors, whereas Google took an opposite approach, organizing it with their algorithms. And so what we're seeing in medicine is a very similar thing. Right now, a lot of the access to the physicians and their team is gated by humans. And when we ask questions, we have to kind of go through a network of people to get the answer to our question. But oftentimes that results in some delayed information and delayed relevance. And so with sort of the advent of new technologies, AI, we can allow and enable patients to get answers to their questions almost immediately. And those answers come at a time where they're helpful and they're informative for their questions. And it sort of gives us a new opportunity to rethink how we help patients prepare and recover from medical procedures and surgeries.
So, from an orthopedic surgeon standpoint, when you said that medical information or even access to an orthopedic surgeon is gate kept by humans, give us some examples of what that looks like.
Yeah, great examples would be a patient recovering from surgery being concerned about bruising and swelling. Oftentimes, the best way to get that answer is to review either their instructions that are printed for them or call the office and wait for somebody to give them a call back with the answer. Paper instructions, for whatever reason, don't seem to work too well. Patients just have a hard time finding the right information. And when they call the office, typically they're met with a delay of anywhere between 2 hours to a couple of business days. That results in a lot of anxiety and fear for patients that what's happening to their body as they recover from surgery is abnormal or concerning.
Hmm.
By the time they get their answer, oftentimes those symptoms have either improved and resolved themselves or worsened to some degree. And so patients are sort of left frustrated by not knowing the right information. With new technology, patients have access to their physician's instructions immediately, so they can ask questions about bruising and swelling and get a response right away. That helps them sort of calm their nerves, reassure them that those changes are normal, and then they can continue with their recovery. I like to kind of think about it as navigating to a new place using GPS or Google Maps. Certainly, we know that the robot powering Google Maps is automated,
Hmm.
but the information that it gives us is so relevant and so timely and so accurate that we don't care. And I think patients are starting to feel that way about some of the aspects of their medical care. They're just really looking for a timely answer to their question that helps either resolve their fears or direct them into a better care pathway. And that's really some of the concepts that we're highlighting in the article.
And exactly what you said, as a primary care doctor, sometimes it's very difficult to see a clinician, especially in primary care. So they go online, and whereas back then they Google their information, now we have AI and large language models, publicly available models like ChatGPT and Gemini, and patients are getting quite detailed answers to their questions.
Yeah, and I think for patients, it just allows them to kind of have access to the best information as quickly as possible. And it's better than the alternative of calling the office and not getting an answer. And so I think that these new technologies, if used in the right way, can be very powerful to help patients feel more supported and experience quicker recoveries and be more satisfied as they interact with the health system.
So you said used in the right way. So as an orthopedic surgeon, as patients are going online or to AI to research their problems, what are some of the pitfalls that you see in your practice?
Yeah, great question. I think as patients use, Dr. Google to answer their questions, the trouble with that is that, sometimes Dr. Google is not giving the same recommendations as their own physician, or the instructions that Google is providing is not as specific as they may need for the instructions to be helpful. With our company Streamed, what we do is we use the physician's instructions as the knowledge base that the models reference when answering patients' questions. So, unlike talking with Gemini or GPT about any health related concern, when they ask questions into the physician's messaging program, they get answers that are prescribed by their physician. And so they're very specific answers that sort of match the care culture and treatment preferences of their doctor. And so patients can feel that extension of the physician when they're interacting with our messaging programs rather than sort of the generic instructions that are provided by Google Online.
And when it comes again in orthopedic surgery, that's your field of specialty, what will be an example of some of the variation between general information on GPT and something that's more personalized from yourself?
Yeah, just a simple question like when can I take a shower after knee or hip replacement, or when can I change my bandage? Asking those types of questions online, they're going to get a generic response that says oftentimes your surgeon will put a bandage on that can be left on for, anywhere between a couple of days to a couple of weeks after surgery, and you should just follow your surgeon's prescribed instructions. That's so generic that it's actually not that helpful for patients and can create more questions and more calls to the office. If those questions are texted into the streamed messaging program, they're going to get an answer that's very specific, prescribed by their physician. And so that response might say something like, your bandage is waterproof. You can leave it on for the first 7 days of your recovery. When you shower, you can let water wash over the bandage. And once a week has passed, you can take off the bandage and leave the incision uncovered at that point. And so that's such a comprehensive response that it answers the patient's questions immediately. It doesn't require any staff involvement, and patients are able to kind of go on with their day. When they have a positive interaction like that and it provides them the information that they need, then they'll keep coming back to the program with additional questions because they're sort of entrusting that process as they go through it. Just like when we're driving down the road and somehow Google knows about construction that we're not aware of and it reroutes us, it sort of enacts additional trust in that program for us. And that's really what we're trying to harness and build on. And, patients know their docs can't text them one or two times each day, so they're comfortable with it being an automated program, but the information matches their treatment preferences. And so they become very accustomed interacting with that channel.
How common is it that there is such a variation, for instance, with discharge instructions between orthopedic surgery practices?
It's very common. Each surgeon has their own specific training background or little nuances. And so while you could imagine, I had a knee or hip replacement, shouldn't it kind of be the same? We all have very different treatment instructions. And so it makes two things very difficult. For patients, they're not able to find the information online. They're having to search through their physician's instructions. And then for the office staff, it creates a lot of friction because as we work with our medical assistants or nurses, they may come to learn my treatment preferences, but if they're cross-covering another physician,
Hmm.
they may not know theirs. And so you're having to kind of get this cross coverage, multiple people training. And so it's just a lot to remember. And I'll even see in our practices, the nurses will keep little cheat sheets, Excel files or Word documents housing physicians' treatment preferences, and they kind of go to those as patients have questions. We're really trying to block and tackle those common challenges in the clinic and sort of deploy these digital messaging programs that allow patients to get that instant information.
So give us a sense from the patient experience standpoint when using your AI solution. Just tell us a story or scenario about what it's like for them.
Yeah, as patients sign up for surgery, certainly they're going to have a lot of questions and concerns, and our office time with patients is limited, right? It may even
Yeah.
be limited to just 20 or 30 minutes. And so what I always tell my patients as they say, there's a lot to remember. Would you like to receive some text messages to help you prepare and recover? Of course I would. Okay, great. Have you ever received a text message? And they'll say, yeah, I have. So we sign them up for the messaging program, and those messages will start trickling into their phones for a couple weeks before surgery and for like the first 6 to 8 weeks afterwards. Those messages, of course, are informational, but they're also supportive. And so patients feel a connection to my office because, I'm kind of highlighting all the specific challenges that they could have emotionally, as they have anxiety, as they prepare and recover. Most of my patients say all of my patients say that they love my
Mhm.
messages. It helps keep them on track as they prepare and recover from surgery. And they comment that it feels like there was a camera watching over me. It just
Mhm.
seemed like the right information came at the right time. And I think that that's built out of the fact that I'm an orthopedic surgeon. I know
Yeah.
what questions they're going to have when, and helping to give them that information just makes that recovery process so much smoother. And it actually feels a bit like a concierge experience for them without having to increase the headcount and the overhead of my practice. To provide this level of support to patients in a manual way, just like, what Yahoo was having to overcome, we would never be able to do it. We just couldn't do that with a human team. So that's why we've sort of leveraged the technology to act as an extension of our team.
Now, how do you train your model with all your different preferences and customizations that you want to give the patient?
Yeah, so when we onboard physicians into our program, we collect their treatment preferences, and then those treatment preferences serve as the knowledge base that the models reference when replying to patients' questions. So we're not having to spin up our own models and create our own training environments, but those models are held within guardrails based on the treatment preferences that are stored in our system.
Now, do you have any clinicians or even your colleagues where they may be a little bit technology adverse and maybe want to give more personal recommendations rather than something that's AI generated?
Yeah, I think that there's always that initial apprehension that says, this technology is not going to be good as talking to my staff or talking to me. But what we've found is we have an extremely high customer retention rate. Anyone who started to use our program has continued to stay with us. And we're not trying to replace the physician or team. We're just trying to augment it and be an extension of it. We've always had our focus on simplicity and ease of use. So that's why our messages come through traditional text messages, SMS. Patients are not having to download an app, create a username, remember a password, and that just makes it technologically appropriate for patients to interact with. And then on the physician side, there's nothing for them to manage. It really feels invisible for them, and that's purposeful. We knew that if we had to create additional workflow or have the physicians monitor another clinician inbox, it would never work because we're actually trying to cut down
Hmm.
on staff responsibilities rather than add to them. And any solution, I know if I brought it to your clinic and I said, yeah, this has to be staffed, you're going to have to hire 1 to 2 full-time employees to manage this software, but it's great for the patients. Well, that's great, but it's not going to
Yeah.
work in our clinic.
Any issues with things like hallucinations or if it misinterprets the syntax of a patient question, it'll give the wrong information? Any concerns about that?
It's always a fear. Certainly, it's something that we monitor. Hallucinations are a problem when the when context is not included. And so in all of the interactions that patients have with the program, we embed their patient-specific context within that conversation as well as pair it to the physician's treatment preferences. And so keeping the model very focused and aligned with that reference source is very helpful to prevent those hallucinations or the models, kind of veering off transversely.
We're talking to Kevin Campbell. He's an orthopedic surgeon. Today's Kevin MD article is Healthcare is having its Yahoo moment. Kevin, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, firstly, I'd just like to say thank you for having me and keeping your mind open to this new technology. I think anytime you're bringing technology into your medical practice, there's some things that you have to overcome because of the fear that it's going to be like the technology that's brought into your practice in the past. We really try to take an opposite approach here, helping the patients, but also the physicians and their teams to create a more efficient workflow while making patients feel more supported and cared for. So I would just like to say thanks again for having me. It's been a pleasure to share our story with your audience and always available for any questions or follow-up commentary.
Kevin, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you.